What do you think the future holds with genetic testing, doctor?
Well, I think that in the future, the majority of people will have genetic testing, even if they don't have family history. And this is because people are curious, because genetic testing is less expensive. Sometimes I see patients in the clinic that said that. And even if they don't meet criteria, I'd rather test them than going in online and do the testing and make mistake in misinterpreting what that means exactly.
And I'm so glad you brought that up, because when you say people are curious, and I agree, I think a lot of people are curious, but when it comes to doing it, and Cristina, this is where you come in. Do you have people who say, okay, I want to be tested, but then all of a sudden they go, this is me. I don't know if I want to hear the results, and a little bit of nervousness sets in. Does that happen a lot?
Yeah, so.
Like, be careful what you're asking for, right?
That's precisely why we have pre-test counseling. So we want to essentially talk to the patient about what this information is, how they feel about receiving those results. Are they ready to receive those results now? So we want them to know exactly what they're getting into, and that they're in a good place to find out this information. That also sometimes includes saying, hey, do you have life insurance in place? Because like Dr. Martir was saying, this law that protects against discrimination from health insurers does not protect against discrimination from life insurance. So in some cases, we just want to make sure that individuals are prepared, that they're in a good point in their lives to have this testing, that we're not essentially doing harm by doing testing. And if they are not ready to hear the results, they can wait, or they can decide not to pursue testing.
Because quickly, doctor, it's one thing if you have a family history like Angelina Jolie, where she really wanted it. It's another thing to just say, oh, I'm just going to do it, and open Pandora's box.
Well, yes, and what we see sometimes is that there are many cancers in the family, and people test positive for mutations of cancer that are not in the family, and that cause a lot of stress. What we want to explain is that the reason of this genetic testing is for knowledge. Knowledge is power, and if you know that you can do something about it to prevent cancer, you can change your life, and what happened to your family doesn't have to happen to you. So we explain in detail.